Hi, I'm Dr. Hemanta, Dhungana, orthopedic surgeon at Virat Hospital. Today I want to talk to you briefly about the common condition called carpal tunnel syndrome. Well, what exactly is a carpal tunnel syndrome? Carpal tunnel syndrome is a condition where the main nerves, the median nerves that goes in the hand, get compressed in an area we call it carpal tunnel. And the carpal tunnel is really nothing more than a space in the wrist that has boundary above by a thick tissue. We call it a ligament, and the bones on the other side. The carpal tunnel contains 9 tendons and 1 median nerves, and when the space in the tunnel gets smaller, for example, when tendons increase the size, as with the repetitive use of the fingers, for example with the typist, or increase fluid as with pregnancy, or when the ligaments get thickened, as with the people who use lots of pressure in their hands, for example the people who use the vibrating tools, the median nerve get compressed. So the most common type of carpal tunnel syndrome is idiopathic, which means we don't know what causes it. It has a genetic predisposition. The number one risk factor for carpal tunnel syndrome is genetics, and other risk factor includes disease such as diabetes, hypothyroidism, rheumatoid arthritis, or other inflammatory conditions. Carpal tunnel syndrome is more common in women than men. Symptoms that patient experience when it occurs can vary. Early symptoms include numbness and tingling of the fingers. Pain can also be felt, which wakes you up at the night. Weakness in the hands and fingers is a late complication of the median nerve compression. The diagnosis of carpal tunnel syndrome is basically made through the history and the physical examinations. The patient history will give you 90% what you need to make the diagnosis, but the physical examination is very important too. The first line treatment for carpal tunnel syndrome is a splint. If the condition is diagnosed early, simply wearing a splint can take away your symptoms and cure the problem. In some cases, an addition of the steroid injection can be helpful. When carpal tunnel syndrome is more advanced, where this numbness and tingling is constant and the hand is weak, we can sometimes even see the muscle wasting. Then we typically go for the carpal tunnel decompressive surgery. So if you have these problems, I'm here to take care of you. I'm Dr. Hemanta, orthopedic surgeon at Virat Hospital. Thank you.